our uterus. Next, what is the uterus? Uterus is a beautifully complex, pear-shaped organ that nurtures life from its earliest part. It is the cradle of creation, housing and nourishing a fertilized egg until birth. What about uterus transplant? Uterus transplant is a new type of fertility treatment that provides the 1 in 500 women affected by absolute uterine infertility, or FI, a viable path towards parenthood. It is unique as it allows the experience of pregnancy and delivery.
For the function of the uterus is, firstly, serves as the site of the embryo implantation after fertilization. Secondly, provides a safe and supportive environment for fetal development during pregnancy with fetus. Thirdly, protects and nourishes the fetus through its muscular uterine wall. Fourthly, plays a role in a menstrual cycle through the thickening and shedding of the endometrium. And lastly, involved in labor and childbirth by contracting to deliver the baby. For the function of uterus in homeostasis, it helps maintain reproductive homeostasis by responding to the hormonal changes during the menstrual cycle. And then, it also regulates the endometrial lining through follicle growth and shedding to prepare for possible pregnancy. Also, provides a stable internal environment for embryo implantation and fetal development. It also supports maternal fetal homeostasis during pregnancy by protecting the fetus and allowing proper exchange of nutrients and waste via the placenta. And lastly, contributes to overall hormonal balance by interacting with estrogen and progesterone levels.
We begin with the comprehensive patient counselling. It is vital that the recipient understands the elective nature of this surgery and the risks involved. Next, IVF is performed first. Because the uterus transplant is temporary, we must harvest egg and create frozen embryo before the transplant. This ensures that once the surgery is complete, we can proceed directly to the embryo transfer without the stress of egg retrieval on the transplanted organ. Once viable embryos are secured, we move to the transplant itself, where the donor uterus is surgically connected to the recipient's blood supply. Then, the post-operative will be performed, focuses on the ensuring the take of the graft. This involves strict monitoring for organ rejection and managing the patient's initial dose of immunosuppression. Last but not least, after the patient has stabilized, then embryo is transferred. The resulting pregnancy is managed as high risk, leading to the planned C-section delivery to protect the integrity of the graft. Finally, because this is an ephemeral transplant, a hysterectomy is performed after the desired number of the children are born. This allows the patients to stop taking anti-rejection medication, returning them to a normal health baseline.
Moving on, I'm going to explain what are the effects of uterus failure. So the uterus failure can cause a hard time and are critical. The first one is uterine prolapse, where the muscles and tissues around the uterus become weak. This gives effect on urination in terms of leaking and incontinence of being, feel of heavy, and pelvis problem. Secondly, the effects from uterine atony, where uterus doesn't contract properly after childbirth. Generally, the effects are low blood pressure, fast heart rate, and excessive blood loss. Now, what are the side effects after uterus transplant? So normally, people who have an organ transplant has side effects. So the patient will experience surgical risk during surgery and C-section delivery. Also, they will have a risk to experience uterine graft failure, commonly due to blood clots formed in the vessels connected to the uterus. And the most serious issue is risk that involves IVF and pregnancy. In short, the fetus is exposed to immunosuppressant, that is anti-rejection medication that leads to low birth rate and renal issue. Hence, it's important to aware the side effects of the uterus transplant before undergo its surgery.
Islamic view on uterus transplant. The views of previous Islamic scholars discussed that the donation and acceptance of uterus are related to the prohibition of sterilization practice, which can have implication of changing the creation of Allah subhanahu wa ta'ala. This practice is contrary to the prohibition mentioned by Allah subhanahu wa ta'ala through his word in Surah An-Nisa, ayah 119. A'udzu billahi minasyaitonir rajim. وَلَأُضِلَّنَّهُمْ وَلَأُمَنِّيَنَّهُمْ وَلَآمُرَنَّهُمْ فَلَيُبَتِّكُنَّ آذَانَ الْأَنْعَامِ وَلَآمُرَنَّهُمْ فَلَيُغَيِّرُنَّ خَلْقَ اللَّهِ. And verily I, which is Satan, will mislead them and will raise vain desire in their hearts and will command them to cut off the ears of cattle, and they will indeed cut them off, and I will command them to change the creation of Allah.